An Auckland man who spent hundreds of dollars in hospital parking fees to visit his premature son has launched a petition calling for charges to be scrapped. More than 9,500 people have signed his online petition calling for district health boards to rethink how they manage parking, which can be very expensive. Edward O'Driscoll reports.
Alex Dexter, whose baby was born on Tuesday, says he has been in and out of Middlemore Hospital for the past 2 weeks. He says he has had to pay for a new ticket every time he visits, and the bills are stacking up.
I've just put all my time into staying with them and seeing them pretty much 12 hours a day and paying about 20 to 40 or even more to see them.
Alex Dexter says although it's cost him a lot, it's nothing compared to people who spend months visiting relatives in hospital.
There's women that are here staying by their terminally ill father's side, and then at the end of the day, they have to go out and pay, and otherwise they can't go. It's basically they're getting held to ransom. You can't go until you pay.
Outside Wellington Hospital, Sally Dryland and her wheelchair-bound elderly mother Wendy were taking a break from their 75th day at the hospital. Sally is thankful that they get a parking subsidy and only have to pay $5 a day, but it still adds up.
It's made it harder, and it is definitely a cost. I wouldn't like to say that it would stop us from doing what we need to do.
The standard parking rate for a day at Wellington Hospital is capped at $10. We asked people there today whether they should have to pay.
People who come to hospitals are not here through choice, so I don't believe parking should be charged.
It's tough enough at the moment coming into hospital if you've got some problems. I think the parking should be reduced greatly.
It is very minimal. I think you've got to have some system with car parking that probably has to be paid, because otherwise people will abuse it.
Alex Dexter also thinks hospital staff shouldn't have to pay hefty parking fees. The New Zealand Nurses Organisation's industrial advisor, Leslie Harry, says most nurses would agree.
What our members tell us is that the fees for parking are costly to them. It's not an overly well-paid profession, and that takes a significant chunk out of their income.
Leslie Harry sympathises with the people who've signed the petition, saying parking at hospitals is an ongoing problem. The county's Manukau DHB says ACC, which operates the Middlemore Hospital car park, doesn't have to pay a lease, and that was done to keep costs low for visitors. For Checkpoint, Edward O'Driscoll.